Good morning and good afternoon. My name is Nicol and I'm a senior fellow with the Public Policy Institute of California. Thank you all for tuning in today to day 3 of our virtual conference on Bridging California's Digital Divide. In today's session, we'll examine equity. Specifically, what is the role of digital equity in improving outcomes across a broad range of sectors, including education, health, and the economy. A couple of housekeeping items before we go. As a reminder, PPIC is a public charity and does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. At the end of today's program, we've set aside some time to answer your questions. So if you have any questions for our audience, for our panelists, please send it along with your name and also organization to the email address that is showing on the screen. The email address is ppiceventquestions@gmail.com, and we will do our best to answer as many questions as we can. Now, I'd like to welcome Soo Song. He is Digital Equity Advisor in the Office of Education and Technology and the U.S. Department of Education. Soo will be moderating today's panel discussion. Welcome, Soo.
Thank you so much. Good afternoon, everyone. Thank you all so much for joining this session. And also thank you to PPIC and you for inviting me to moderate this awesome discussion. I had a quick chance to take a look at the registration list, and it looks like we have representation from a wide variety of folks, from local, state, and federal government to community-based organizations and nonprofits, private sector leaders, and some school districts even. So I hope each of you will have something to take away from the next hour. Just to quickly introduce myself, I'm Soo Song, serving as the Digital Equity Advisor at the Office of Ed Tech, or OET, at the U.S. Department of Education. And we're the office at the Department of Ed that's primarily responsible for developing that national vision around technology-empowered teaching and learning. And we do that by publishing the National Ed Tech Plan, which is undergoing a refresh right now. Since arriving at the department in the fall of 2021, I've been serving as the office's principal lead on various efforts and initiatives to advance digital equity for all learners. And that's done often in collaboration with other federal agencies that share our vision, like the White House, FCC, and NTIA. And you can find out more about our office and the work that we do on our website, tech.ed.gov. So with that intro out of the way, I would like to welcome our panelists. Their bios are actually on PPIC's event page. So in the interest of time, I'll do very brief intros. So our panelists today are Kristina Ishmael, Deputy Director for the Office of Ed Tech at the U.S. Department of Education, Mei Kwong, Executive Director at the Center for Connected Health Policy, and Nicol Turner Lee, Senior Fellow and Director for the Center for Technology Innovation at the Brookings Institution. It's great to see everybody today. They represent a wide range of expertise that will help us answer the guiding question for this session. What is the role of digital equity in improving outcomes across education, health, and the economy? So we'll just dive right into the questions. Let's just start by describing the issue at hand, the digital divide. Which communities lack access to the internet and devices the most? And how does access differ by different characteristics like geography, age, income, and language? I'd like to start with you, Kristina, and then we'll move to Mei and then Nicol.
Great. Thank you so much for having me. It's a delight to be here. Diving right into this question, you're going to know the answer, Soo, but this is obviously based off of the work that you've been doing around digital equity and access as part of the bipartisan infrastructure law that President Biden signed in November of 2021 that actually codified into law a definition of digital equity as well as digital inclusion. And we were able to kind of identify 5 specific groups of folks that were furthest from digital equity and opportunity. So those are our rural students, our urban students in historically digitally redlined areas. And those are the folks that have access on one side of the street, but don't have access on the other side of the street in large urban settings. Our Native and Indigenous students, as well as our folks in kind of non-traditional settings as far as our adult education, which often get left out of these conversations, and our adult learners in that process. And so we've identified those groups and been able to kind of look at how a lack of access means that they are not necessarily getting to those opportunities. And of course, we can look at geography as part of that. My previous experience working in the state of Nebraska obviously knowing that there is just a lack of infrastructure in some of those rural settings. Also what we heard from our Native Indigenous populations as well. So definitely those types of, or those specific groups.
Thank you, Kristina. May, would you like to add on to that?
Definitely, and Kristina did a great job in highlighting a couple of the factors that, spread across both education and in healthcare, where there could be complications for digital equity. Other areas as well that we've seen in healthcare also includes age of population. So perhaps not as much for education. Definitely we've flagged seniors who may have issues accessing connectivity, but also digital literacy as well too. That could be an issue as well for seniors, and also people from different backgrounds and cultures as well have that issue too. And another thing to highlight, it's not just the connectivity as well, but access to the actual equipment, at least for healthcare, to be able to get those types of services via technology. So perhaps not having a laptop or a smartphone. And then again, to just emphasize the digital literacy side of things, even if you have those, do you know how to use those to access healthcare services?
Absolutely. And Nicole, I know you've worked in a lot of different sectors. Would you like to add on to anything that Kristina or May talked about?
Yeah, no, thank you for having me. And just to sort of complement what you just said, Chisoon, I'm actually working on a book that'll be out next year on the U.S. digital divide. I want to add on to what my colleagues have suggested in terms of some of the known traits that actually distinguish who has access and who doesn't have access. But I want to overlay that as well with some of the systemic inequalities that we've experienced in our country that complicate those measures. So when Kristina talks about urban communities that are redlined, obviously, we have problems with digital equity and access because we have problems with housing equity and access. And the same thing shows up when we begin to trace where we see health disparities and other disparities that affect people. And the other thing I kind of mentioned in my book too that's worth mentioning when we talk about who's affected. In spaces like rural communities or indigenous communities, where we've seen people who either make a choice to live there. As part of my book, I went around the country and I met with many people who were in digital deserts. Some of those folks in rural areas either choose to be there and cannot participate, but they have viable lives as well. Farmers, entrepreneurs, individuals who came home to maintain the general wealth of that small Main Street store. There are folks like that that live in communities who already, by the nature of where they're located, are not having access to economic opportunity, let alone digital connectivity. So I wanted to add that because I often think that we think of the digital divide as a very binary construction, and really it's not. It's much more sophisticated, much more layered, and much more intersectional.
Absolutely. Secretary Cardona talked about the digital divide when he was recently at the Aspen Ideas Festival at the end of June. And he talked about the digital divide as not just serving as, the haves and have-nots, but it's really about access to opportunities, like Nicole, you talked about, right? What kind of doors does it open? And if you don't have access, what kind of doors does it close? And speaking about those barriers, one barrier that's so significant in a lot of different areas around the country is the topic of affordability, right? The affordability of getting access to broadband. And we know groups like Education Superhighway have done some analysis, and they've found that it's one of the most significant barriers to getting access to the internet, and which is why our office, the Office of EdTech, have made it a core pillar of our recent Advancing Digital Equity for All guidance resource. And also, we also launched the Online for All campaign in partnership with the White House and Civic Nation to promote the Affordable Connectivity Program. So just wanted to open up the discussion around that specific topic of affordability. How does affordable access open opportunities in health, education, and the workforce? And with that question, I want to start with you, May.
Well, I mean, for healthcare, it's a lifeline. If you can have that connectivity and then you can afford it. I remember at the beginning of the pandemic, Kristina touched upon Indigenous populations, talking to some Indigenous populations. They said, for our folks, it's the difference between access to healthcare through connectivity to telehealth or paying for food. So, and that's, a situation I think for a lot of people. So it is a lifeline for them. And it goes beyond healthcare as well, too. I mean, how much of having connectivity is like integrated into like our everyday lives? I mean, it's really like another pillar of our utilities. It's like electricity and water too these days. So not having that really puts a lot of people at a disadvantage. So to make it affordable, and I applaud the federal government and state governments that have been looking into this issue. As somebody who's been in telehealth for over a decade, it's something that we've talked about for a long period of time, but it has not really gotten the attention until the pandemic happened and everybody realized, oh, maybe it's a good idea and everybody does need connectivity. So I applaud them in doing that, but it's still not enough. And it's also not going to be a problem that's going to be solved in 12 months. So it's something that we still need to really invest in and investigate and really expand these programs. There's been a great start, but for a lot of people, it is essentially their lifeline for a lot of things.
Yeah, so many services and programs have moved online, especially in the last 3 years. Really, that access, affordable access, becomes a lifeline in many different communities. Kristina, anything you'd like to add on to what Mei said?
I just think about my former students. So I'm a former early childhood and elementary teacher in Omaha, Nebraska, and the majority of my students were emerging bilingual or multilingual learners. And so coming to Omaha as refugees or possibly migrant workers, limited as far as their actual finances. And so this was one of those situations. Are we going to put food on the table, or are we going to have internet access? And we've seen certain, certain gains with the pandemic and commitments from internet service providers where they are agreeing to lower costs or to provide different data plans that are available to folks that are subsidized through the Affordable Connectivity Program. But we also had to make sure that we were going back, because at the very beginning, we had data caps. We had issues with if folks had any sort of remaining balance, they weren't able to access those lower cost kind of programs. And so we had to then go back and ask for the internet service providers to amend those things. And some have, and there's still room for improvement. And so we continue to advocate for the affordability in multiple ways.
Yeah, and that's why, we've been pushing so hard on enrolling additional households into the Affordable Connectivity Program. I'm sure many folks in the audience know already about the ACP, but if you don't know already, eligible households can claim up to $30 per month when it comes to getting affordable internet access from participating providers in qualifying tribal lands. That benefit goes up to $75 per month. And we've looked at the research on what's barring folks from getting enrolled in the ACP. And one of those barriers is just simply, being aware that the ACP exists, right? I think folks like the Benton Institute have done some surveys around, the needs of low-income populations. And it seems like in low-income households, less than 50% knew that, the ACP even existed. So that's why we've been working hand with the FCC to the White House to launch this national campaign, the Online for All campaign, to make sure that folks are taking advantage of it. And in the last month or so of the campaign, we were able to enroll approximately 1 million additional households into the program. And we were able to show one of the highest enrollment weeks during our week of action back in June. So we're continuing to push on that momentum. And on that topic of affordability, Nicole, I didn't want to skip over you and your perspectives. Maybe anything else that you'd like to add there? Anything you've learned from your national travels and the communities that you've spoken with?
Yeah, so I've been doing this for 30 years. Affordability is not a new concept when it comes to broadband access. And in particular, we actually have a universal service program that actually was supposed to buffer affordability concerns. And that would be the program of Lifeline. The challenge that we had is, I like the way he talks about it, all of a sudden the digital divide became known to many people, even though we've been dealing with it for very many decades. And so part of this conversation around affordability is really a conversation today, not about whether or not people can get access to a competitive provider, but more so whether or not people understand the relevance of broadband in their lives. People are struggling a lot of things these days, much more from when Ronald Reagan put the Lifeline program into place in the 1980s. And these concerns, which really the ACP came out of the Emergency Broadband Benefit, which was a pandemic relief program, has had exponential growth. I think 19 million people have subscribed across the US, But there are challenges, right? Because at the end of the program, whether it expires in 2024, runs out of money, the same 19 million people and plus that we actually subscribe will have the same challenge again, which is why people need to buy my book, because I talk about all of this in my book. Because one of the things that we have to recognize around affordability, and I love the way Kristina talked about it, it's a combination of things, right? It's whether or not people can afford monthly service. It's also like a young man that I met before the pandemic in Stanton, Virginia, who ran out of data. His data caps disallowed him from finding a job, and he was a day laborer because he did not have the bandwidth on his phone to have access to jobs. Or a young woman that I met in Phoenix, Arizona, who was working with her doctor via telehealth on a late stage cancer diagnosis, but actually struggled to maintain her service to keep up those visits in light of the fact that the expenses were high for her to maintain her phone. My point is, we've got to continue to talk about affordability, but we've got to talk about it in a more permanent way, because the challenges that we're going to have going forward really have some part of it dependent on cost as well as intent. And this goes back, I think, to what people have been talking about on this panel around why we're actually caring about this, right? It's not necessary to give people access to shiny objects and devices, but to connect them to a world of opportunity, like the secretary said, that should be something that justifies and validates why this has to be a long-term program.
Absolutely. And when we talk about affordability, it's not just about, maintaining a connection and, being able to pay your monthly bills, right? There's fees associated with just installing the necessary systems and equipment at your home. When you consider devices, right? Those devices, go outdated, faster than you think they do. So how can you maintain those, right? So there's all those sort of hidden costs when it comes to this topic of affordability. And we need to take a look at all of those factors. I definitely agree. In addition to affordability, the other topic that I want to make sure we hit on is the topic of digital skills. And sort of a fun example I like to bring up all the time are the conversations that I have with my mom in trying to get her to use like mobile banking systems, right? Instead of going to Bank of America every week to deposit checks and things like that. But just because she has one of these in her hand doesn't mean that she has the necessary skills and the capacity to use that tool to her advantage and build economic opportunities for herself, right? That's just a fun example I like to use, but there are more serious examples around the country, right? Access to, job opportunities being online, access to credentials, being placed online. So those kinds of things can impede barriers to opportunities like we've been talking about today. So on that topic, Nicole, I'd love to start with you on this question. What kind of barriers do folks that don't have those necessary digital skills face? And on the flip side, what kind of opportunities can we create if we invest as a nation in solutions to build those critical digital skills?
Well, again, I'm going to be a little bit more provocative because I think this concept of digital literacy sort of started when I started in this space 30 years ago in the community technology movement. I mean, what we're experiencing now, and I'll give you some recent work that we've done at the Brookings Institution, is that if you go back to what Kristina talked about in terms of the Infrastructure Investment Act, we've got $65 billion, probably upwards of that now, $1 trillion that is going to have to be spent in infrastructure development. But yet we have a limited workforce to do so. And a lot of those jobs, as we found in our work at Brookings, do not require a college degree. So when I think about when we give people access however it comes, whether it's through wireless or wireline connectivity, satellite, broadband through power lines, of which I've seen in Nebraska, the key thing is connecting people to 21st century opportunities. So my hope, Ji-Soon, is actually that we don't have these conversations around teaching people how to turn on a computer, because intuitively, I think my friend John Horgan has suggested over the years, people know how to do that. It's like getting a new dishwasher. You kind of know how the buttons look and how to operate that. You've seen that. Even the most isolated people in the United States and across the world know what it's like to get online for something. The key thing is, are we using these technologies to improve people's quality of life? And that's an area I think that when we talk about literacy, and again, I speak about this in my book, it's really important that we connect the dots with quality of life outcomes for people so that when they are getting the training that they need, they're getting training that is necessary for them to survive in a new digital economy. And I would even say for the health part of it, that when they're using telehealth, we're using it to actually quell and to sort of reduce health disparities that we actually see in communities that are socially isolated. Give this one example real quick. When I was working in the city of Chicago doing this work, a woman that was helping me from the community, we both had children at the same time. Both of our children had asthma. I had primary health care insurance and I could take off of this, job that I was doing because I wasn't truly dependent on it. And as a result, over the years, my son outgrew asthma. This young woman, and this was in the 90s, she literally lost the job because she had to continuously go to the emergency room to get care. And when she had to see a secondary care specialist, she had to take off of work. Could you imagine what her world would have been like today with telehealth and telemedicine? My point is having access matters today because it helps to quell some of these other inequalities that actually plague a lot of people across this country who are stuck in this vortex of problems that we have not yet solved as a nation. And so I do think when we talk about literacy, we have to expand it beyond what skills are we giving people? It's that plus how are we helping people improve the quality of their lives going forward?
Yeah, it's really about empowerment more than anything. Right. I was talking to an organization that helps build digital literacy skills among the elderly out in Hawaii. And I asked the individual leading that organization, what's been the most, rewarding part of your experience, right? And he was talking about how this 80-something-year-old, client of his, she's been coming to all these classes to learn how to use the computer and different websites and applications. And she was able to start an online business, using the skills that she developed from this organization. So it was really more about empowerment more than anything, not just those discrete skills of how to, use Chrome or, learn what Amazon is and things like that, but being able to, create those economic opportunities for herself in her 80s, right? So those stories like that, really, emphasize for me and underline for me the work that we're doing and what we're, ultimately trying to strive for. Kristina, would you like to add on to anything that Nicol said? Yeah.
I just think that we have a lot of literacies we talk about in education. Digital literacy, it seems to be one of those that has surfaced with the pandemic, of course, of the importance of it, because it was not, the onus was not just on the learners themselves. And when I'm talking about learners here, I'm specifically referencing K-12 learners, because when we had to quickly pivot, our favorite word of 2020, to emergency remote learning, we were then putting the onus on our families and our caregivers and multi-generational households where folks might not have had those literacy skills. And so, yes, we can play with the buttons and we can get on there, but do folks understand that if we are on a video conferencing platform on this computer, that it's going to, throttle our bandwidth over here on this device so that we might not have grandma that would be able to go to their telehealth doctor's appointment. So we have to also understand kind of the boxes and wires sometimes and have those conversations. And while this generation of our K-12 learners have been born digital, that doesn't mean that they understand how to actually use the technology for active use. We talk about this a lot within the Office of Ed Tech as far as how we want to get past that substitution of technology so that it's just replacing analog things. But we also have to bring alongside our families and our caregivers and our elders in this whole process.
Absolutely. And then finally, Mei, anything that you'd like to add on to what Nicol said about those opportunities in healthcare? Yeah.
So I don't disagree with anything that Nicol and Kristina have covered here, but I do think healthcare is a little bit different in some ways. We talked about empowering people and empowering them to, utilize technology, understand technology, and use it to better their lives or improve their lives. Healthcare is a little strange, and this goes beyond telehealth and technology in that I'm not quite sure that people feel that empowered when they're in the healthcare system. They usually follow what oh, my doctor recommended that. And are they asking the questions? Do they know their rights? Do they know that they can request this? So I think it's more of you need to probably also educate people about healthcare, what they're entitled to, what they can ask, how they navigate the system. I've seen it personally myself. It's very confusing. And I've had family members where, side note here, personal story, I had a relative who was in the hospital. It was a serious condition and they were going to send him to nursing home. I said, I don't think this is quite right. He's not ready for that. And then sure enough, because I squawked about it and complained. They did another MRI and they found he had a spinal epidural abscess, and they were going to send him to a nursing home with this.
Yeah.
So, but everybody was saying like, no, just listen to the doctors. They know what they're doing. It's so that's another thing I think patients need to be empowered in, like knowing their rights, knowing the questions to ask their medical providers as well. Now, when you talk about telehealth and like educating people how to use that, there's 2 steps on there. And this is something that I've always talked about to the telehealth technology developers, like you got to make it simple. If the patients are utilized, not only the patients, but for the providers as well, they don't want to click on 50 screens. This may look really cool to you tech bros, but this is not going to work for the patient. It is not going to work for the provider. They've gotten better at that. But that's one thing, is like they need to like not make it complicated. But in telehealth, there's been no sort of cohesive or, widespread education of patients on how to use the technology. That has been left to the providers, and the providers have so much to do. They are not only treating patients, but they have other requirements and regulations that they need to meet, like such as inputting information in the medical record, of making sure they're not doing HIPAA violations, et cetera, et cetera. Now they're being asked to, well, you need to be the primary educators to patients on how they do this. And not all of them are particularly great at that, because that's not necessarily the role that they have. Some of them are, but it's also been very ad hoc for patients. And it's like, maybe you have like this one health institution that's really great about like, informing patients about that, but then you have somebody else who's not as good as that. So it's been very uneven there. And that's been sort of like what healthcare is facing. It's like all these levels of education where there hasn't been sort of like this very cohesive, widespread, sort of, almost standardized type of education. So patients all come in knowing at least a certain level of information.
Can I add on?
Yep, go ahead.
May I add on to that too? And I think that's so interesting. I love the way that you speak about that, because I think that's something that was revealed across a variety of institutional structures, right? We saw it in education, the same type of how do we empower teachers to actually go above and beyond just teaching when we had emergency remote connectivity. I love that concept, right? How do we also look at that with regards to work and the future of work and people who are not prepared? And I think the bigger question when you talk about equity is that you're putting in place all of the things, the criteria that need to ensure that people are able to make that pivot and shift. And I love what you're talking about, because one thing that we wrote about at Brookings is the fact that there was an expectation, for example, during the pandemic, that everybody turn on their cameras. And there were a lot of people who couldn't do that within the environment that they were in, because maybe they were at a public library or maybe they were someplace else. And so we were very flexible, right? Remember, with asynchronous and synchronous care, the key thing is there are some conditions of digital access that make these easier for people. But we really do, like I said, have to go through and really interrogate these institutional structures that already create barriers before we even deal with digital access.
Yeah, thank you so much for those perspectives. And, especially with regards to healthcare, this is not a perspective that we get to hear all the time being at the U.S. Department of Education, right? The sort of the issues that healthcare providers have to go through with so many things on their plate, which is actually kind of similar to, stories that we've heard from educators in schools, right? They have so much on their plates right now with trying to, pursue social and emotional development opportunities for their students, making sure that they have the mental health supports that they need, making sure that we're putting together instructional acceleration strategies. And on top of that, the digital equity and inclusion side of things, how can we balance that? And this is where, through our national conversations, we've learned that those community-based organizations and the partnerships with those that have been doing the work have been so critical. Right. I'm recalling a conversation that I had with an organization out in California that helps with refugee families from Burma, right? And they used to provide other types of social support services, but during the pandemic, because of the relationships that they had with their those communities, they were able to, offer digital skill building opportunities, connect them to affordable internet programs and things like that, to make sure that, those community-based organizations are empowered, and, schools, providers, can take a few things off their plate a little bit, right? So, and on that topic, I actually want to move on to the topic of the solution side of things, because so many of us are connected to the stakeholders and groups on the ground. So we could talk about the issues that we've heard, for an entire hour, but I do want to, talk about the solutions that we've seen from around the country. Could you describe for us, some of the recent, efforts in your own sector, education, workforce development, healthcare? What are the successes and what could be done to improve some of those existing efforts? And Mei, could I start with you on this question?
Sure. I mean, I'm sure everybody is aware, and we've touched upon this when the pandemic started, there was this hard pivot towards tele for healthcare delivery. It was not planned this way, but it seemed like a great solution for the situation we are in. You can continue to provide some healthcare services and limit interaction and possible spread of infection of COVID. So that was a great success. Now, for folks who aren't familiar with it, before the pandemic, not a lot of people were using telehealth. So when we did that hard shift, that was a hard shift for a lot of people, not only for patients, but for the practitioners themselves too. And a lot of them really, met that challenge. It was a little bit bumpy. What helped was the sort of waivers that were put in place both on the federal and the state level to allow providers to do this. We kind of mentioned it too in the healthcare sector. There are other policies that people and providers need to be aware of that could create barriers. A big thing is licensure. I'm not sure for education, but I kind of suspect if you had a student who was in California but had to go to Nevada for some reason, they can still attend class. Doesn't happen that way in healthcare. There's licensure laws. So there were relaxations of those policies to allow that to happen. And I think that was very successful in standing up these programs. Where we're now at, though, is we're out of this public health emergency. So some of those policies have rolled back, some have stayed, and some, especially when you're talking on the federal level and what they've done around the Medicare program, they're in a temporary holding stage, a grace period, if you will, where they'll only last till the end of 2024, the major ones. What that creates then is a very uncertain landscape for providers. So do I then continue this telehealth portion of my practice, or do I have to wind this down, inform my patient, transition them back over to in-person services, et cetera, et cetera? That uncertainty creates, a lot of anxiety for practitioners because they're not quite sure, what do we need to do now? But also creates uncertainty and anxiety for patients. We talk about those patients who are receiving telehealth services because that may have been the only option that they had because of their situation, whether they're, in a rural community or something, or they have limited access to certain providers. They're saying, what's going to happen to us now if you suddenly roll this back? So that's been a great success, but it's a success that could be taken away. And then you could deprive people of services. And I know policymakers are very cognizant of this too, and they're struggling with it as well. But the longer that uncertainty goes, I think the more anxious both practitioners and patients are going to get.
Thank you for that insight. And I see a lot of nods from our other two panelists, so I want to move over to them and get their insights. Nicol, could you talk about the solutions that you've seen in your national travels and the communities that you've engaged with?
Yeah, I mean, I think, certainty is key. I so agree with my colleague here that, the uncertainty that is coming out as we declare the pandemic over is actually going to impact a lot of the type of investments and relief that we had for these emergency situations. And what's so baffling is that these emergency situations worked in certain instances. So when I think about telehealth, which I've been doing too for the last 2 decades, right? We've come so far. We actually had this breakthrough in terms of its increase in usage, but we also are struggling with fragility given what's going to happen on the policy level. And the same thing with the Affordable Connectivity Program and the other federal appropriations that we're actually seeing to support accelerated broadband service. So one of the solutions I would suggest is that we need to make this more permanent. One of the things I argue in my book, we've been doing this for 6 presidential administrations, the same thing. And so it's important that we sit down and we put a stake in the ground that this is an important issue for us in this country, and we ensure that we have nobody left behind. And I think, one of the real concise recommendations I would give is something I actually put forth for schools. We need to ensure that no child is left offline. And I think as a policy solution, we need to think about the same way that we constructed No Child Left Behind to do the same thing in terms of No Child Left Offline. It's a travesty that we have 50 million school-age kids come home, a lot of them not have access, and we found that out in a state of emergency. And if we want to fill some of these STEM roles that we have, cybersecurity roles, we have a similar investment in semiconductors and chips, it's important that people have access to these tools, especially as the technology becomes more sophisticated. So I do think we need to go back and revisit some of the traditional communications policies that we've had in place, the policies that govern our federal agencies, and really bring them up to not just the 21st century, but future-proof them for future generations. It was just a travesty that we were not prepared for that. The last thing I would say, another solution, and this is for people who are listening, as you delve into these issues, we need to stop seeing people as just consumers of technology and really enable them to be producers in this technological sector. Because if we're going to maintain our innovation, particularly in states like California, where we're seeing a groundswell of innovation for this country, it's important that these are not first sight or early adopter technologies. We need people actually understanding that these are radically changing the way that they live, learn, and earn. So I'm not running for president, I'm not running for office, but I have to put that out there. I might sound more like a preacher, but my point is, like, we've come to a stage where we've actually learned that giving people access can be helpful and it can work, but it can only work if we move people beyond the stage of consumption and we really address people as producers who have a stake in the ground of this new technological ecosystem in ways that can transform our innovative economy.
Thank you so much. Kristina, your insights on how we're responding to that kind of call to action.
It's a big lift. First, I have to say I'm incredibly grateful for the ability to access telehealth and telemental health personally. It has made a massive difference in my life that I can fit it into more of my life and that I can carry on, but still get the support and the services that I need. And we also see that obviously happening in schools now too, where we are getting more access to telehealth services and telemental health services to kind of increase the overall mental health supports that we have through our Better Safer Communities Act and the funding from that. And that's a really important piece that I think is sometimes overlooked, that we are trying to, develop the whole child in a K-12 system or in a pre-K-12 system. We're in California, TK. And it's so important for us to think about the child, not just as the learner in a classroom, but also making sure that they have those support services that are available. So I'm really glad that we actually get to do the intersection of health and education and workforce here. I think one of the other things that we've lifted up in our digital equity work is just around those community-based organizations, because there is that trust already, and tapping into those organizations, whether they are faith-based organizations, whether they are nonprofits, or even our public libraries. Those are all critical kind of infrastructures as part of our society that we have had to rely on for many of these services. And we could not have done the things that we've done over the past few years without them. And so we do want to continue to lift up the work that they're doing, making sure that we recognize that what they're doing. I also think, in 2016, we released our National Ed Tech Plan, which is the flagship document that comes out of our office. And our mission has always been around, national ed tech policy to really think about how tech can transform teaching and learning. But we also included that everywhere, all the time learning. I know that you had mentioned that at the beginning, Jisoo. We know that learning does not just happen within the four walls of a classroom. And so we've seen that obviously more with the pandemic, and that our families and our caregivers also got to see that with their learners who were continuing their learning outside of the traditional school hours. And so I think it's important that we also open our minds up to the fact that learning happens everywhere, and access to reliable high-speed internet is a part of that, and is required to open up the opportunities there.
Thank you. And just want to go back to what Nicole said about that topic of no child left offline, right? I think one thing we need to do is to make sure that different sectors that don't often talk to one another actually collaborate when it comes to solving this issue and ensuring that all all of our learners can access online opportunities. And the critical moment to do that is now, as states are developing these digital equity plans and their BEAD plans with the funds that they receive from the bipartisan infrastructure law. We've been putting out a national call to action for states as they're developing this plan to talk with educators, talk with parents, talk with students who live and breathe the digital divide on a daily basis, to hear about their barriers and hear about what kind of strategies they find to be promising their own communities. And we put out a call to action blog on our Department of Education homeroom website back in April. We've been highlighting model states that have been doing a really good job of making sure that both at the state level and the local level, voices of those educators are heard. And we've been also sharing with the education field, opportunities that the state broadband offices have made open to give input through public listening sessions, public surveys, to give input to those digital equity plans, right? And now we see a handful of states have already released drafts of their digital equity plans for public comment, and they seem pretty hopeful to me, in my own opinion, right? Many are showing evidence of having worked really deliberately with the education sector to make sure that they're crafting strategies and commitments to closing the digital divide for our students who are furthest from opportunities in their state. So I'm pretty hopeful in the way that we are moving things forward as a nation.
Can I just add on that one? I agree with you. And I'm so glad that you brought that up, right? Because the infrastructure spending is not often talked about in panels as helping to support these types of gaps that we're talking about today. We always look at it like, well, let's just give people broadband and they'll figure it out, right? I think a key thing to actually just tag on what you said is we hope that states, particularly those that are struggling with educational equity, health equity, job equity, prioritize those things when they're putting in the boxes and the wires, as Kristina said. Because again, we don't want to oversaturate communities where we're not helping them solve particular problems. So I love the way you talk about that. I would love, when I have done this work and I'm often in a room with educators, for example, I ask them if they know about this program. They're like, no, we don't, right? And we need to raise awareness, because at the end of the day, and it's already been said for my colleagues, the action is going to be precipitated from the people who are on the ground. And if they don't have the resources, we'll most likely, as I'm sort of anticipating my book, sort of see the same thing. Because we have not changed the way in which we actually look at this particular problem.
Chisa, could I also add something?
Yeah, absolutely. Yep.
So I would encourage the healthcare field to get more involved in these discussions. I don't think they are as involved as they really need to be and are at the tables. And part of that is we just came through a pandemic and so many people are burned out. So many people have so many things on their plate to address that, broadband may not be at the top of their priorities, but it is, I think, very crucial that they have the healthcare industry at that table, providing their input, discussing things as well too. And I would also add that for patient groups as well, who are related to healthcare, to also be involved. And I'm not quite as familiar with it, but if they're not, I also encourage them to also be involved in these discussions with people related to housing, to really need to also provide their input into these plans.
Yes.
Absolutely.
Intersectionality. Here we go.
In about 3 minutes, we're going to the audience Q&A. So there's still time to submit your questions, so please send them to the email address on the screen, ppiceventquestions@gmail.com, and include your name and organization. Before we move on to audience Q&A, I just want to have this one wrap-up question for all the panelists. How does the work look different, when it comes to approaching digital equity at the federal level, the state level, and the local level? Especially Mei and Nicol, are there specific issues that you all focus on when you're advocating at each of those levels?
So first off, CCHB does not advocate. We're not a lobbying organization. So let me make that clear. We're a resource and informational and technical assistance organization. So we do get different levels of government coming to us, asking our opinions or information or data or background information. It's very different on the federal level in that it's one policy. It's the federal level. So it's one thing. But when you're talking about the state level, at least for CCHP, We're now dealing with, you include DC, 51 different jurisdictions, and they have 51 different approaches to things. And they have different resources from what they're working with. Like California invested $6 billion on the broadband issue, but you don't have other states that maybe had like those funds available to invest that. So they have different approaches. They have different geography. My point is, at least definitely from like the healthcare side of things, when we view it, it is not going to be a one size fits all necessarily is going to work. You're going to have to take into account like the different populations, different communities. Geography is going to be a big issue as well too, in how to approach this. So that's going to be a thing, is that there's not going to be one easy solution, and like the solution, it's going to take us a while to eventually get there, because when you're talking about digital equity, that's a lot of infrastructure involved there, and infrastructure does not move that quickly. It takes a while to build up things. And then for healthcare, you're also talking about, when you're talking about infrastructure, I include workforce in that as well too. Definitely with healthcare, you don't give like 6 months of training and you've got a doctor. It takes years and years to develop that as well too. And the healthcare industry is like really facing shortages of like healthcare personnel to do this. So this is technology is a way. It's not going to be a solution, but it's like another tool to help alleviate those pressures. But it's still, we're still facing like these shortages, still facing these problems. It's not going to be the end all be all solution, but at least it can help alleviate some of the immediate problems.
And I would just add on to that. So I had an old boss in the early 2000s that used this analogy that I'll share today. And he called it the 3 C's, meaning that people were consumers, constituents, and, community residents, the same person. And that same person cuts across local, state, and federal lines. What we're seeing in this stage of broadband equity is a lot of investment on the federal side, directing states who, along with localities and sovereign areas, to sort of think about how to solve this problem. Again, it's coming with a very large size of portion of federal investment. And I would add, we don't often talk about the US Treasury investments that are running alongside of these investments. So I think we're gonna have a lot of money. The question is, will we meet the needs of consumers, communities, and constituents? And that, to me, is probably the most critical part of the discussion that intersects all 3, without, going into detail on what Louisiana is going to do over Nebraska, what California is going to do over Georgia. It's really, are we looking at our communities in an indigenous fashion? Are we looking at our non-traditional anchor institutions, that's been said? Are we thinking about our topography and geography? And are we trying to solve some really serious concerns that we have for our states and our cities in ways that make sense and will be highly adopted and make the investment worthwhile? I would also say another common thread are partnerships and collaboration. I mean, we cannot do this work without the help of industry, other government agencies, some citizen groups and community-based organizations, and people themselves. And so again, I think the challenge is, we've got only 5 years, and we've got 5 years to do something within a political box, which we have to keep considering. How will this live after these monies are gone and some of these processes for collaboration are cease? So that would be my answer to that. It's not going to be a one-size-fits-all solution. That's not worked for us in the past. But the same person cuts across all of those localities and jurisdictions. And the key thing, are we meeting their needs?
Absolutely. I think that's a really great transition, because it looks like the audience questions are coming in, and they do talk about specific individuals and types of individuals that can be served by the work that we're doing. So question 1 from Jeffrey: California's population is aging and aging fast. Soon it is projected to have 20 million senior residents. How can we better connect those senior residents to essential services, healthcare, and other services? Does anyone want to respond to that question around how can we best serve folks who are aging? Yeah.
Well, I think I'll jump in. I mean, I think obviously there is a lot of research that's been done on the older populations and technology, of which an area of interest to myself as well. I mean, again, technology can enable seniors to age gracefully in place. provided it's a complement to the other things that we've already spoken about, which are, sufficient home health care, the fact that you need this type of support. We're going through this right now with my own mother, where the technology enables us to do certain things. She's older, but, again, with the rising age of populations right now, that not only come with age disparity, but also a host of other comorbidities or chronic illnesses, it's important, again, for us to leverage these technologies in ways that make sense. One last thing that we haven't talked about, which I think is also pertinent to digital equity, I'll give a great example. A couple of years ago, I heard about a story of the AARP that went out and bought Alexas or voice-activated devices for senior communities. They put one in a public housing development in DC, which was Eastern European. They put the other set in a public housing development in Baltimore, which was predominantly African-American. Both sets of seniors landed up never using those devices, even though it was suggested that the technology would help them with scheduling and sort of loneliness, etc. And why was that the case? Because the Eastern Europeans, the voice activated system could not understand their accent. So whenever they said something, it came back wrong. And for those in the Black community, they were just afraid to talk to the device based on concerns of distrust and surveillance. My point is, for that question, technology will only be able to go so far. Clearly we want people to be connected for the purposes of efficiency and being connected to family and friends. We saw that happen over the pandemic, but we also have to be careful that we're not deploying technologies that do not have their lived experiences in mind, and that are not including them in the process of developing these new technological tools or training. So I like to always share that, because I think we say oftentimes, well, we just give senior technology, it's gonna be great, right? Well, it's not all the time, right? Because it doesn't always work that way.
I love that story, and I think NTI has done, crafted their policies in a smart way in ensuring that states are engaging with organizations serving what they call their covered populations as they develop their digital equity plans. I think there's like 8 or so different covered populations, one of which is our elderly citizens, right? So that, the federal investments that are coming down the pike, they're not being spent on things that will, be on the shelf, a couple months down the road, right? So making sure that the organizations serving these specific populations are at the table as folks determine how to best invest them, right? Mei, Kristina, any other insights in terms of how we can best serve our aging populations?
I think Nicole pointed out a very important aspect of this, not only just for the aging population, but just in accessing services, is that you need that community level engagement there. I think part of the issue that the BEAT program and the connectivity programs may not have had as much uptake as there was is that it was coming from top down, from a federal or state agency. And you have people either not hear about the information, or they may be like a little wary of getting involved in government programs. So they needed that community relationship in order to, feel comfortable in accessing the program. Another thing is, in response to the question, there needs to be better coordination across multiple agencies. I mean, too often agencies work in a silo, and it's like, you've got things that go across both your agencies that if you kind of work on together, we might avoid duplications or inadvertently putting up challenges or barriers for folks as well. So, I really would encourage that, government agencies engage more with each other in order to create sort of a more seamlessness system or easily accessible system for the population to access these services.
Kristina, anything you'd like to add there?
No, my colleagues here, they got it.
Great. Then we'll move on to the second audience question, which is about a different covered population, individuals with disabilities, right? People living with disabilities are 3 times more likely to not access the internet. How to help them with digital skills training so that they can access and navigate essential services. And not to toot our own horn, but one resource I would like to point this audience member to is our digital equity story engine on our Office of Ed Tech's website. If you go to tech.ed.gov/stories, you'll see examples of innovators out there in different communities who are serving different populations, especially in terms of building digital skills and connecting them with different resources. One organization that we highlight there that's doing exactly the work that you're calling for is the ARC And we published that story back in May during the Global Accessibility Awareness Day month. So would encourage you to check out that story and the National Tech Coaching Program that they're running over there. Any other examples folks have seen from around the country when it comes to serving, our individuals with disabilities?
Well, I would add, having been exposed to this particular issue over the years, a lot of this has to do, and I think it was mentioned earlier, about equipment and the adaptability of equipment to be accessible to people who have limited ability. What monitors and what text looks like, what does text to translation look like? How does we want to be sure that, for example, in the Affordable Connectivity Program, where we're telling people, okay, you got $100 to put towards the device, that we're recognizing the additional support that will be needed to ensure that people are able to access this who have disabilities. I'm hoping that out of the digital equity funds that the BEAD program has assigned, even though it's only $2.7 billion compared to $1 trillion, that some of those programs will actually be targeted to our communities with disabilities, where they're able to overlay some of these adaptable technologies that just make the experience much more useful. I think going forward, and this goes back to the previous question for the aging population as well, people are only going to use technologies that they trust, that they think are accessible to them, and that they believe are going to be useful in whatever journey they're on. And this applies to all populations, but in particular to our populations that tend to be overlooked when we're actually talking about new technology. And so, I would just say to that person, there is a need, and as a researcher, sociologist in doing this, there really is a need for a greater scan of this landscape. My hope is that these immediate solutions that we're pumping into communities and states, et cetera, will lend itself to more longer term research, that we can actually see how this effectuated change in certain populations, covered and uncovered, going forward.
Other panelists would like to weigh in on this question?
It's, for telehealth, before the pandemic, this was actually like an area where telehealth did not do a lot of investment. It's like treating, or, how do you utilize telehealth to treat a patient with a disability? Part of that reason was because telehealth was not just widely used. So it just was not on a lot of people's radars to do that. That obviously changed with the pandemic. So that's great. More awareness, more people asking questions, more people like trying to adopt it or adapt it to treat these patients. The other thing is, well, with healthcare, it's like, you have to. It's required by law that you provide these services with somebody with disability. So yeah, it's great that you're doing this, but you probably should have thought of this and been doing this for a while now. So CCHP is one of 14 telehealth resource centers. So we receive federal funding to provide these technical assistance services that we do. So the telehealth resource centers at the beginning of the pandemic have started to develop, various research resources for providers in order to, lead them on or educate them on how they would adapt the technology to treat a patient with a disability. And we're also gratified to see like other sort of groups take this up as well too. The North Carolina Deaf and Hard of Hearing Department have done a series of fact sheets for both patient education and provider education. So it should be a little bit further along because, again, they should have been doing this before the pandemic, but at least we're starting to see these types of educational materials, people asking these questions, this type of training starting to happen. Definitely, a lot of room for improvement, but we're moving along in this as well, too.
I know we only have 3 minutes left, and I do want to get to more audience questions, so these might have to be some quick hitters. The third audience question is for Mei. You talked about the possibility of telehealth options being taken away, and this uncertainty that creates for providers and patients alike. Why would this be? It seems this option has been so positive. Why isn't it more certain that telehealth is here to stay?
The short answer to that is that telehealth itself is not being taken away. It's the coverage for telehealth. So your Medicare, your Medicaid, your commercial payers, will they pay for it if telehealth is used to provide those services? So it's not that the ability to use telehealth is taken away, is that is anybody going to pay for it? And if like a provider can't get that covered, they're probably not going to offer it. Then there are a host of other policy issues. I mentioned licensure earlier, and those rolled back. It's pretty complicated. I'm happy to talk to people offline as well because I don't have time here. But those are like the various factors that go into it. It just makes it a little bit more challenging for a provider to be able to offer those services, what's happening with these policies.
We're at 2:59. So Kristina, quick hitter question for you. What kinds of educational opportunities are challenging to deliver in an online space? And what can we do to improve those experiences with online education?
That's a great question. That could be a whole other topic for a webinar. I think really, honestly, we've done this since the late 90s and the early 2000s when ed tech was first introduced into classrooms, where we have used the technology in that substitution manner, and it hasn't actually changed the pedagogy and the practice in the classroom to look at different learning models using the actual learning sciences and the way that learners learn. And so I would say the ones that are actually more challenging to deliver are the traditional forms of stand and deliver and lecture, because it's not engaging, because we know all of these things now. So being able to provide access to more project-based learning and inquiry-based learning, where we're asking learners like big questions around real-world problems or like large essential questions that they can then go out and start to do their own research and learn in that whole process. That's what we'd like to see.
Thank you. And Nicole, please take us home. What is this book that you're writing and when will it become available?
So the title of the book is Digitally Invisible: How the Internet is Creating the New Underclass. And it will be available probably about March of next year after it goes through all the rigmarole of the press. But it will be coming from Brookings Press, and it will be available on Amazon and in your local bookstores. Thank you for that question.
I think that's about all the time we have today. So thank you to New, PPIC, and all of our expert panelists for joining us this afternoon. And thank you for those of you in the audience for joining us today online. If you pre-registered for the event, you'll receive a survey. The folks from PPIC would really appreciate it if you could take a couple of minutes to respond and give us some feedback. Thank you again for joining us for the past hour, and have a great afternoon.